Interpreting medical research studies and evaluating the credibility of health information is essential for making informed healthcare decisions. Here's how you can effectively navigate medical research and assess the reliability of health information. Understand study design. Familiarize yourself with different types of medical research studies, including randomized controlled trials, RCTs, cohort studies, case control studies, cross-sectional studies, and systematic reviews, meta-analyses. Understand the strengths and limitations of each study design in terms of establishing causality and generalizability. Assess study methods. Evaluate the methods used in the research study, including study population, sample size, study duration, data collection methods, statistical analysis, and potential sources of bias. Look for studies that use rigorous methodology and adhere to ethical standards. Examine results. Analyze the study results and determine the statistical significance of the findings. Pay attention to effect sizes, confidence intervals, p-values, and measures of association to assess the strength of the evidence. Consider the clinical relevance of the results and whether they are applicable to the population of interest. Consider confounding factors. Take into account potential confounding variables and sources of bias that could influence the study outcomes. Look for studies that control for confounders and address potential sources of bias through study design or statistical methods. Evaluate peer review. Determine whether the research study has undergone peer review by experts in the field. Peer-reviewed studies undergo rigorous scrutiny by independent reviewers to ensure scientific accuracy, validity, and reliability. Check funding sources. Investigate the funding sources of the research study and any potential conflicts of interest. Be cautious of studies funded by industry or biased sources, as they may have vested interests that could influence the study outcomes. Consult multiple sources. Seek information from multiple credible sources, including peer-reviewed journals, government agencies, e.g., National Institutes of Health, Centers for Disease Control and Prevention, professional organizations, and academic institutions. Compare and contrast information from different sources to gain a comprehensive understanding of the topic. Look for consensus. Consider whether the findings of the research study are consistent with existing scientific evidence and consensus within the scientific community. Look for consensus statements, guidelines, and expert opinions from reputable organizations to corroborate the research findings. Critical appraisal tools. Use critical appraisal tools and guidelines to systematically evaluate the quality and reliability of research studies. Tools such as the Critical Appraisal Skills Program, CASP, Checklist, or the Joanna Briggs Institute, JBI, critical appraisal tools provide structured frameworks for assessing research validity and relevance. Seek expert advice. When in doubt or faced with complex medical information, consult with healthcare professionals, researchers, or specialists with expertise in the relevant field. They can help interpret the research findings, clarify uncertainties, and provide personalized guidance based on the latest evidence. By employing these strategies, you can develop the skills to critically evaluate medical research studies and discern credible health information, empowering you to make informed decisions about your healthcare and well-being.